Welcome back to Carolina Company Live. We're live on location at Carolina Orthopaedics right here in Murrells Inlet. Now, they got 3 locations: Myrtle Beach, Murrells Inlet, Georgetown. I mean, this is an amazing place, 24,000 square feet, and we have another doctor to talk to.
That's right, Dr. Stephen Parker. Thank you for being with us today.
You're welcome. Thanks for having me.
How long have you been practicing with Carolina Orthopaedics?
I am going into my 4th year with Carolina Orthopaedics.
Okay, and your specialty?
Pain management.
Oh.
I am the physician and partner of the group that handles neck and back pain predominantly.
Oh.
We also deal in workers' compensation injuries, and of course you've heard about the sports injuries and others.
Sure. Well, there's a lot of pain out there, so you've got
Yeah.
your hands full, I'm sure.
Absolutely.
Now, one of your new medical breakthroughs is genetic testing. I mean, what's that about?
So part of the specialty of pain management has to do with medical management, because despite your best efforts sometimes, you end up having to engage in chronic medication management. And so every week it seems you hear about some terrible story regarding pain management physicians and what's happening in this country with the overprescribing of medicines. A lot of that has to do with finding the right medicine that works for the patient. So now we can be spot on with respect to what medicines work in you the best. And so genetic testing involves taking either a salivary sample or swabbing the inside of the mouth, sending it off to a lab, and then getting information back as to which medicines work the best in you, which ones may have an intermediate effect, and the ones you should stay away from.
That is
interesting. And you don't over-medicate anybody.
Wow.
Absolutely. Well, the tendency to do that is much less, but also the cost savings, because you think about how many times physicians write medicines that don't work.
Right.
Only to have them come back, which is impactful not only to the system or the third-party payers, but to the patient, because there's a financial requirement with respect to co-pays and that sort of thing to them. So it goes a long way towards eliminating some of those things and making it a safe practice for all parties concerned.
Oh, wow, that's fantastic.
Absolutely.
Technology in the way is just changing everything. It's
Absolutely.
wonderful.
And now, what type of surgical procedures are you going to be doing here?
Well, I perform the only surgical procedure that can be considered a surgical procedure for me would be something called the kyphoplasty.
Okay.
Kyphoplasties are treatment done to patients who undergo compression fractures, but mostly I'm a proceduralist as it pertains to pain. So epidurals, facet injections, spinal cord stimulator, trials, and radiofrequency lesioning, which is a very hot procedure right now too for spinal stenosis.
So if somebody comes in with pain, you can help them.
I try.
And the best part about this, I like that testing where you don't over-medicate, because so many times this happens. I mean, you get so many different medications.
Absolutely, and being in Myrtle Beach, which is largely becoming a very popular retirement community, things change, and with respect to how you handle medicines, treatments, illness in general, and the genetic testing really is helpful with respect to that.
Yeah, that's fantastic.
Thank you for being here. We appreciate it. We do.
Thank you so much.
We're live here at Carolina Orthopaedics. We've got more in just a moment, so stay right there.